So, welcome everybody. My name is Marty Mascari. I am a contractor under the North Central Texas Area Agency on Aging and the North Central Texas Aging and Disability Resource Center, both of which are under the umbrella of the North Central Texas Council of Governments in the greater Dallas-Fort Worth, Texas area. Just for those of you that are from outside the area, the offices are just about 2 blocks from Jerry World, from the Cowboy Stadium. So that's a very important thing to note if you live, especially if you live here in Texas. So we're here today with our cohorts at the Area Agency on Aging and our partners at the Better Business Bureau Education Foundation in Houston to talk about our midweek Medicare, the Medicare open enrollment, and not to take the bait in some of these phishing scams that are out there. And I shouldn't say some, there's a million of them. So hopefully you'll get some education there too. But if we could advance the slide one, Leslie, if we could, I'm going to go over the CEU requirements.
Hang on.
And then once
Okay.
we do that, that's all right. That's why we're,
Here, trying to get it to this.
yeah, there should be.
Okay, wait. I can't get it. Oh, wait. Here we go. Here we go. How about that? Did it work? How come it's not working? There we go.
There it is, right
There.
there. Perfect. Perfect. So for those of you joining us today that are wanting to earn continuing education units for licensed social workers and licensed professional counselors, um, we are set up in the state of Texas to provide those complimentary for y'all if you complete the entire live webinar and fill out the evaluation form. If you have a different license in Texas or you have a license outside of Texas, you're more than welcome to go through the process, um, get a certificate from us, and submit it to them. But just please note that those jurisdictions, it's totally up to them whether they would take it or not. I've had people tell me they've been able to use them, but that's totally up to those jurisdictions, licensing jurisdictions. I have had a couple of times where the jurisdiction has reached out to me for like copies of the PowerPoints and things like that in order for them to determine whether they accept it. And so you're more than welcome to have them reach out to me if you would like. But just so you know, we're set up for licensed social workers and licensed professional counselors in the state of Texas. We're also providing certificates of attendance for people that just need or would like to have a certificate noting that they've attended the seminar today. Please note that the rules are the same to get either one of the certificates. Today's webinar is going to be worth 1.5 hours of CEU credits. You must be on for the entire live webinar. If we go past by chance asking questions, you're not required to go past the time, but you must stay on till the 11:30 end time in order to qualify. You must then also complete the Google evaluation survey. That will, when you close out of Zoom today, it will ask you if you'd like to go and take a brief survey. That will take you to our Google evaluation survey. But if you don't find that for some reason, the link will also be sent out to you in a follow-up email that's sent out to everyone who attended. And then you can just go in and fill it out from that link. Please note that that follow-up email will likely not go out until tomorrow morning. And then you would have 1 week from tomorrow to finish that survey before the survey is closed down. And then please give us about 4 weeks after that, after the survey closes, before you call us looking for your certificates. Your certificates will be emailed to you, but there's all sorts of things that back it up. And so if you can give us the 4 weeks before you reach out to us, but if you don't have it by the 26th of October, please feel free to reach out to us and let us look into and see what the issue is, so we can get that fixed for you. So I'm going to turn you over to our cohort my cohort at the Area Agency on Aging, Melinda Gardner, and she's going to introduce our speakers today. Welcome, Melinda.
All right. Thank you very much, Marty. And as always, thank you for coordinating our midweek Medicares. These have been going on probably for a couple years now. Once the pandemic hit, we found this was a good way to get information out to individuals, not only professionals, as well as clients. So we do hope that you are sharing this information with others so they can join no matter where they are at. We would appreciate it. All right, if you could go ahead and advance the next slide, please. Oh, all right. Nope, go back. Okay, so our speaker today for the Medicare topic will be Simon Manrique. He will be telling us about Medicare open enrollment. Helping him today is Leslie Kilton. She will be advancing the slides. Simon has been with the Area Agency on Aging about 5 years and every day helps individuals understand Medicare, and we are grateful for him being a part of our team. Also presenting today is Angel Hansick. She is the program director for the Texas Senior Medicare Patrol. And since the last midweek Medicare, that is a promotion for her. So congratulations, Angel, on your promotion. And thank you for presenting for us today. Don't take the bait, phishing scams. I will be helping with the Q&A as well as Felicia Warner. And so all of us are helping out, and hopefully you will be able to learn some important information that you can also share with others. So without further ado, I will turn it over to Simon for our first presentation.
Good morning, everyone. How y'all doing today? Again, welcome and thank you for attending. Miss Melinda, how much time do I have for the presentation? Melinda?
You have about 40 minutes.
All right, good. So I can set my timer. You know me, how I like to talk sometimes. So anyway, getting that going. Well, good morning, everyone. Again, I just want to thank you for attending. My name is Simon Manrique, Benefit Counselor 2, and I am here with the Area Agency on Aging. We are part of the North Central Texas Council of Government, and this presentation is going to be in reference to open enrollment that's coming up here on October the 15th through December the 7th. And get this going. Next slide, please. I am also part of, or we are part of the CHIP program, which is the State Health Insurance Assistance Program. And then we're also with the Senior Medicare Patrol, and which is utilized in preventing Medicare fraud. With CHIP that we are involved with, we help individuals to understand the cost and coverages that are available to them. We assist individuals in comparing the different options that are available to them. We help them as far as when they're trying to enroll into Medicare or make changes within their Medicare benefits plans. And then also we help individuals in correcting some of their billing issues, what's going on with the billing issues. And we get all these kind of different calls, but that's as the State Health Insurance Assistance Program. That is what we help individuals with. Next slide, please. Again, Medicare open enrollment for 2024, or it's during 2024, but it's going to be for next year. And just to let you know that once you enroll during the enrollment period, a lot of individuals think, oh, I'm going to go ahead and change right now. But the changes for open enrollment usually will not take effect until January the 1st. And you need to be very careful with that and letting individuals know that that's going to happen. The change, you can request the changes during October the 15th through December the 7th, which is the open enrollment period. and then again, will not be effective until January the 1st. Next slide, please. During, again, we're helping during the open enrollment, and we serve as a central source of information, expertise, and technical assistance for individuals that are coming into Medicare. There's a lot of knowledge and then best practices through the development of new products and tools that provide one-on-one assistance to individuals that are requesting information as far as enrollment. There's a whole bunch of different resources that are available through the CHIP program. Roughly 40% of the individuals that we contact occur during the open enrollment period. So we anticipate that the capacity may be reached early. So you're going to get calls, we're going to get calls, and we want to be able to have all the information necessary to help the individuals during this open enrollment period. Next slide, please. Can you go to the next slide? Go ahead. Just go right over it to it. There you go. And a lot of individuals do call us, and when they do call us, they've already talked to someone, they've already seen something on TV, and a lot of times we get individuals, I know with me, individuals will ask me which company I'm with, meaning with them, they're thinking, okay, so you're with a particular private insurance or commercial insurance, and there's a whole bunch of different insurances that are available out there. But no, we're not affiliated with any particular insurance company. We let them know that we're local, we're in the area, we're unbiased, and as far as letting them know which options are available to them, that their information with us is kept confidential. As a matter of fact, each time we get a call, we let individuals know that their information is kept confidentially with us, and we do not share our information with any other entities to be able to have their information and contact them. Again, we're knowledgeable as far as, again, the different options that are available to them. And then, of course, they can reach out to us by phone or in person. Just yesterday, I had an individual that came over to our office, and where I was able to help them in person. And then I think a very good asset that we've obtained is being able to reach out to individuals virtually, let's say. And the reason that we're doing virtual meetings and presentations with some of the senior centers in the Dallas-Fort Worth area, and it's really great that we're able to get that information to them. Next slide, please. CHIP in a snapshot, or the state health insurance system. There's about 54 different CHIPs across the United States. There's one in every state. There's one in every state: Puerto Rico, Guam, DC, and the U.S. Virgin Islands. There are about 2,200 local programs that are available to individuals. Counselors, 12,500 counselors throughout the United States that are available to individuals. And as far as educating individuals, about 4 million individuals are educated within a year's time to let them know, what options are available to them. There's 2.5 million counseling sessions within a year's time to communicate with individuals. Again, we're here to help the individuals, letting them know, clarify the options that are available to them. Next slide, please. So you can enroll in Medicare whenever you want. True or false? Should give us the answer here in just a minute. And the answer, of course, is false. There's a certain set times when you can enroll into Medicare, depending on what your situation. There are rules for each type of enrollment period. There is the Medicare annual enrollment period that begins on October the 15th, again, through December the 7th. Leslie, you can just click on it. It should go to the, there you go. There you go. Thank you. And then we can go to the next slide, please. Medicare costs the same for everyone, true or false? And let Leslie go ahead and push the buttons and it should come out. Does Medicare cost the same for everyone? And again, yeah, that's false. The exact amount you pay depends on the specific coverage you have. I've had individuals that have moved like literally across town. And basically when they've moved across town, they've unfortunately have gone into one county, from one county into another county. And yes, sometimes the same name plan is available in the other county, but sometimes the benefits have a little bit of a change, and individuals all of a sudden a medication may cost a little bit more, or a particular procedure may not be covered because of the changes from county to county. So sometimes individuals will call us and ask us what happened. Hey, how come this isn't covered anymore, or why am I paying less now, which is great. Well, we need to explain to them as far as that when you move because of the specific area that you're in, sometimes changes do occur from plan within the plan from area to area. So you need to be very careful with that and look at that with the individuals. Next slide, please. Does Medicare cover everything? Again, individuals are talked to different individuals. I've had individuals that have called in and said, well, my cousin over here, he's 75 and he gets this covered. I'm only 66 and I'm trying to get this covered, and it's not covered. Medicare Part A and B do not cover most prescription drugs, routine dental, vision, and hearing, things like that. But no, they do. Medicare doesn't cover everything. A lot of times right now with individuals, because of the mass amount of mail that they're getting, emails that they're receiving, commercials on TV about Medicare, these individuals are saying, hey, you know what, you can get into this Medicare Advantage plan, covers dental, covers vision, but it doesn't say exactly what's covered. So a lot of times individuals, you let them know that Medicare does cover, or these Medicare plans cover dental. Right off the bat, they're thinking extractions, fillings, implants, and a lot of those extensive dental procedures are not necessarily covered. Now you can still get the service, but you're going to be responsible for that. So I always try and reiterate to individuals: be careful with the dental, be careful with the vision, be careful with the hearing. Again, they hear it and for the first time, and they're under the understanding that Medicare covers everything, and no, that's not necessarily the case. And that's where we come in as far as letting them know what their options are and what's available to them in their area. Next slide, please. What is Medicare open enrollment period? It's also called the annual election period or fall Medicare open enrollment period. Again, it's from October the 15th through December the 7th every year. And again, if you request any changes during that time with any like a Medicare Advantage plan, where you switch it over to a Medicare Advantage plan, or getting out of a Medicare Advantage plan and going back to original Medicare, and if you do go back to original Medicare A and B, then you need to get your Part D coverage, and you'd have to enroll into a standalone prescription drug plan. So things we need to let individuals know as far as options that are available to them. And if they do make these changes, we need to let them know that these changes will not take effect until January the 1st. So if you make any changes, you need to be careful of that. Okay. What is Medicare's open enrollment? These changes you can make include, again, joining a new Medicare Advantage plan, joining a new prescription drug plan, switching from an original Medicare to a Medicare Advantage plan, or switching back from a Medicare Advantage plan to original Medicare. But remember again, when you go back to original Medicare, it's without your Part D coverage. So you need to make sure that we let them know that they're going to have to enroll into a standalone Part D prescription drug plan. Next. During this time, you should consider looking at the costs that you're going to be responsible for within these changes, the coverage, the providers that you choose. And this will help you into finding the best plan that's available to you. There's different websites that you can go to, but the predominant one that we like to use that really offers a lot for the individuals as far as trying to get them the best information that's available to them is this website, the Medicare.gov website. And within that Medicare.gov website, there is the Medicare Plan Finder, and which next month is going to be some, we're going to do a presentation next month in reference to that as far as letting individuals know how to use that Medicare Plan Finder to get more detailed information within the plans that you want to be. Another thing that I'd like to inform individuals when they switch to a Medicare Advantage plan, I always strongly advise the individuals, talk to your doctor's office. Ask the doctor's office which plan, which companies, which insurance companies they accept, because not all doctor's office accept every single plan that's out there, all the Medicare Advantage plans that are out there. Some people say they do. I've been on the phone with individuals. We've called the doctor's office to verify which companies or plans they accept. I've been on the phone when the doctor's office will tell the individual, we accept all of them. It doesn't matter. We accept them. And my experience has been sometimes where the individual will pick one plan, and lo and behold, they pick the plan that it becomes effective on January the 1st, and then they have a doctor's appointment on January the 25th, and guess what? The doctor's office doesn't accept that particular one. So I always advise individuals, or suggest to individuals, to ask which plans they accept. That way they will know which plans they can try to select and enroll into. So always reiterate that. Make sure that they check with their doctor's office. That's a regular doctor's office, and even more so important, specialists, which plans are specialists. And of course, the perfect scenario would be that the doctor's office, the regular doctor's office, and the specialist doctor's office accept the same plans. Next slide, please. Like I was saying, when you're on original Medicare A and B, then you need to have your prescription drug plan. And of course, there's two ways of getting that. You can get the prescription drug coverage with the Medicare Advantage plan that offers the Medicare health coverage plus the drug coverage, or you can just go with the standalone Medicare prescription drug plan. Those are the two ways of getting the coverage. And as you can see, plans that offer Medicare drug coverage are approved. You need to make sure that those plans are approved by Medicare. And a lot of times they are run by private companies and are available to anyone with Medicare. Next slide, please. You need to have Medicare Part A, hospital insurance, and or Part B, medical insurance to join a Medicare drug plan. Part A and Part B to join the Medicare Advantage plan with prescription drug coverage. I kind of always, when I talk to individuals, let them know if they're switching to a Medicare Advantage plan. I like to let them know, you know, there are Medicare Advantage plans with prescription drug coverage, because wouldn't make too much sense to me why an individual would want to go into a Medicare Advantage plan and only have the medical coverage aspect of it and not the drug coverage. So I always try and let them know there's Medicare Advantage plans with prescription drug coverage, and that way it's all covered. Because I always go back to original Medicare, because if you're on original Medicare, Part A and Part B. Part A covers the hospital, Part B covers the doctor services, and then of course you need to have the prescription drug coverage. And I let them know about the standalone prescription drug plans. Those are the ways to get in it. Or again, if they go with the Medicare Advantage plan, get both the medical coverage or Medicare Advantage plan with prescription drug coverage. And I always ask them to join the plan to get any one of those plans to get the drug coverage that they need. And of course, when they select the plan, they need to make sure that that plan is available in their service area and that their doctors do accept those particular plans. One thing you can't do is be incarcerated or be unlawfully present in the United States or live outside the United States. I have had individuals that travel outside of the United States, and sometimes they know, oh, if I'm out of the country for 3 months, is that going to affect me? If I'm out of the country for 6 months, is that going to affect me? And then of course, if they're out of the country for 9 months, I've had individuals call and answer, and they want to keep the Medicare coverage, but they want to spend time outside of the United States. So I always tell them to be careful with that and to double check, the length of time that they're out, how it's going to affect their Medicare coverage. Okay, next slide, please. Medicare drug coverage, combinations of coverage and cost sharing. Check benefit structures, including tiers. With the prescriptions, there's different tier levels of medications, and depending on the tier level of your medication, it will affect your copays and coinsurance, and cost is different from the types of drugs that individuals take. So we need to look at that information with them when you're letting them know. And the Medicare.gov website does give you that information to clarify for them what they may need. Next slide, please. How should I review my current Medicare health and drug coverage? The changes you can make, again, include you can join a new Medicare Advantage plan, again, with prescription drug coverage, or you can join a new Part D prescription drug plan, standalone prescription drug plan. You could switch from original Medicare to a Medicare Advantage plan with prescription drug coverage, or you can switch from a Medicare Advantage plan to original Medicare with or without a Part D plan. But again, I always strongly suggest that if you're going to go to Medicare Advantage plan, get the prescription drug coverage, because you're gonna need it. Okay, the next slide, please. When you're talking to these individuals, this is one thing that I always try and get them to understand, because I've had individuals that have called in coming into Medicare and are in great health condition and don't necessarily take any medications. They're, in good health, and they're like, well, I don't think I want to spend any money on getting prescription drug coverage because I'm in good health and I'm not taking any medications. But still, one of the things that I reiterate to individuals is that Medicare requires you to kind of have credible prescription drug coverage. You have to have some sort of prescription drug coverage, whether it's through a Medicare Advantage plan with prescription drug coverage, whether it's with the standalone prescription drug coverage, Some individuals, they're still working and they have health coverage through their employer. A lot of times the employer group health plan does include prescription drug coverage, so they can get the coverage. So they have to have some form, or should have some form of credible drug coverage. Each year, plans inform you if your coverage is credible or not credible, depending on where you live. And any lapse of 63 days or more in credible coverage, and you may have to pay a late enrollment penalty if you join a Medicare drug coverage plan later than what you would need to. Next slide, please. What are some of the things I should consider when choosing a Part D prescription drug plan? Does the plan cover all your medications? Very important to have the individuals verify each one of the medications that they're taking. I had an individual one time call me 10 different medications, and they gave me the list of the medications. Again, utilizing the Medicare.gov website, entered the medication to try and verify which medications the plans do cover, depending on the plans that are available in the area. With the plans, you need to verify if the plan has restrictions on any of their drugs, like does the particular plan require the individual to get prior authorization? Is there a step therapy that needs to be done with a particular medication, or if there's any quantity limits? Sometimes on the stronger medications, there will be quantity limits to where sometimes they're only able to get, a 30-day supply at a time, at a month, and not more than that. And again, it just depends on the plan, depends on the medication that the individual's doing. How much will I pay for monthly premiums and the annual deductibles? That's another thing. I've called, individuals have called and they've asked, okay, I'm looking for a particular plan. Okay. And no problem. Okay. Standalone prescription drug plan or Medicare Advantage plan. Either way, once you go into these plans through, in particularly, again, the Medicare.gov website, it will indicate if there's a monthly premium for the plan, and again, the annual deductibles. A lot of these prescription drug plans do have annual deductible. There are some plans that don't have annual deductible. So that's why it's very important when you're helping the individuals, getting them the information in these prescription drug plan portion of it, to verify if there's any premiums and any deductibles. Again, how much will I pay at the pharmacy as far as copay, co-insurance for each drug that they take? The Medicare.gov website gives you that information. When we enter the information, the Medicare.gov website usually will indicate what the yearly amount that the individual will pay for a medication, and that usually includes the premium. And so it'll let you know, it'll give you that information, and so you're able to see that. So again, got to be very careful with that. Next slide, please. In the website, it gives you an opportunity. Again, you enter the medications. It'll even ask you which pharmacy the individuals are using. A lot of times, individuals will tell you, "Well, I use CVS," just as a practice of trying to see which pharmacy will helps the individual, allowing them to pay the least cost amount. Is I don't only select, even though they told me CVS, but I'll look around, see if there's CVS, Walgreens, even Kroger, Walmart, Tom Thumb in our area. I select more than one pharmacy just to see if there's anything cheaper for them, and see what options are available with the plan with these pharmacies. And again, as you can see, the first out there is my pharmacy in the plan's preferred network, because you pay the least if you use preferred network pharmacies. Can I fill my prescription by mail order? You can select that too. What are the plan's star ratings? Again, if I have retiree coverage, will the Medicare plan work with this coverage? Again, like I was talking about earlier, a lot of individuals are kind of still working. Sometimes their spouses are working and they have them in these plans. So does the Medicare Advantage plan with prescription drug coverage, does the standalone prescription drug plan work with their current coverage? You can look at all that information. It is available. Again, the Medicare Plan Finder tool can help to get the list of the Medicare Advantage and drug plans that are available for them. Next slide, please. This is a little presentation. See if you're able to see if we'll run it. Listening. It's a presentation. It's sure. I guess I didn't do it then. Does it give you the option to run the?
No, it doesn't.
Okay, well, we'll go ahead. And it was just kind of a little to let you know what options are, some of the options that are available. Regardless of how you receive your Medicare health and drug coverage, you should consider your access to healthcare providers you want to see, your access to preferred pharmacies, because again, the Medicare.gov website will indicate if a particular pharmacy that the individual indicates that they utilize or pharmacies that are available in the area are preferred pharmacies. And of course, you want to look for a pharmacy that is in network because they pay less when the pharmacy that they utilize is or select is a preferred pharmacy and in network. Okay, so very, very important to make sure that it is a preferred pharmacy. Again, you need to verify your access to benefits and services that you need, the total cost of insurance premiums, deductibles, and current or cost sharing amounts, and the quality of the customer service you receive from those pharmacies. Some individuals just cannot work with their pharmacists, or even the pharmacy assistants that are there sometimes. So you want to get to a good pharmacy that works for you. Next slide, please. If you have original Medicare, again, visit the Medicare.gov website to read the 2024 Medicare and well, that should have been 2025. Sorry, that one got away from me. Medicare 2025 Medicare and New Handbook to learn more about Medicare benefits for the upcoming year. Another thing is you can always call Medicare directly at Medicare at 1-800-Medicare, or you can contact our office and we'll be more than glad to help you. We can even help you get a Medicare and handbook. Yet as soon as we get them, individuals will call us. Sometimes I didn't get it. Well, okay, we can. Another thing, one thing that, as a matter of fact, just yesterday, Braille. We received the Medicare and New Handbook in Braille for individuals that are blind and want to be able to have access to this information. That is available. I think that's fantastic that we're able to help individuals with that situation to where the handbook is in Braille form to be able to help them get the information that they need. And again, you can receive your handbook by mail or even electronically. You can also log into the Medicare.gov website where you can create an account with them, and then you'll have access to the Medicare and New Handbook information there too. Yeah, Chip, we can also provide you a copy by mail. Once we get them, we'll go ahead and give them to them individuals. Go ahead to the next slide, please. If you have a Medicare Advantage plan or a standalone, read your plan's annual notice of change and or the evidence of coverage. Review these notices for any changes the plan caused. You'll get these every year if you're on a Medicare Advantage plan or a standalone prescription drug plan. It'll notify you of any plan cause changes. the plan's benefits or overage rules, or even the plan's formulary. Very important for individuals that are taking certain medications. The formularies may change. And again, you need to look at the medications that they're taking, you're taking. Make sure that your medication is still covered, and then look at the cost of your. Make sure your drugs, again, that are still covered for next year, and that your providers and pharmacies are still in the plan's network. And again, Chip would be more than glad to help you with this and for unbiased counseling. Next slide, please. With these Medicare Advantage plans, because with the Medicare Advantage, remember there's HMO and PPO plans. So with that being in mind, you need to look at, see if there's any premiums, deductibles, co-insurance, copay amounts that may have changed. What's the annual maximum out of pocket with the Medicare Advantage plan? This amount may be higher, but can help protect you if you have expensive healthcare cost. What service areas does the plan cover? Make sure nothing has changed, that you're still within the plan area for the particular plan. Are your doctors and hospitals in the plan area network? What are the rules that you have to follow to access your healthcare services and even your drugs? And does the plan cover additional healthcare benefits that are not covered by original Medicare? And again, that's where a lot of times the dental, the vision, the hearing, the fitness programs that are available to you. And next slide, please. What are some of the things I should consider when choosing a Medicare Advantage plan? Just again, the Medicare Advantage plan usually include prescription drug coverage. There are some plans out there, and it has happened where individuals have looked at a particular Medicare Advantage plan, but did not realize that it did not include the prescription drug coverage. Need to verify, make sure that the prescription drug coverage is still that it's available with the particular Medicare Advantage plan. There is usually with the standalone prescription drug plan and original Medicare, which is just the Part A and the Part B. And again, the standalone prescription drug plans, there is some additional coverage, which is the Medigap policies. Some individuals are aware of them, some individuals are not aware of them. But with the original Medicare, and the standalone prescription drug plan, Medigap policies are available. It does indicate that if you have original Medicare and a Medigap policy, that if you're considering switching to a Medicare Advantage plan from that, you know that your Medigap policy will not work or cannot go with your Medicare Advantage plan. So let them know that these Medigap policies are not available to them if they switch over to Medicare Advantage plans with prescription drug coverage. Next slide, please. A supplement benefit is an item or service covered by Medicare Advantage plan that's not covered by original Medicare. Again, this was what I was talking about earlier as far as the dental, the vision, the hearing, the fitness programs. So you need to look as far as what the plan offers in regards to this, and then see what the plan rules are. Because some individuals have called, they're on a Medicare Advantage plan, they want to be take advantage of the fitness program, and a lot of times they're like, the YMCA accept this, and I always tell them you need to call the YMCA to make sure that this does work with their services. And again, some of the commonly offered benefits include dental, vision, hearing, and there's your gym membership. Or you're not going to necessarily see it as a gym membership, but you're going to see it as far as a fitness program. Some supplemental benefits that must be primary health related. These benefits can either be optional, as far as there are some additional benefits with the Medicare Advantage plans that you can buy into. And so it's some additional coverage, but you're going to have to pay for it. There's some services that are available, and again, you may think you might not need it, but you can't decline the coverage. It's there for them whether they want it or not. Next slide, please. So again, review the plan's evidence of coverage and any other materials that the plan sends you, and then just verify the cost and coverage restrictions associated with each one of the benefits that they're indicating. And again, the dental, the vision, the hearing, the fitness program. A lot of these plans also offer worldwide emergency room services. Some individuals have gone out of the country, and again, worldwide emergency room services. So when they're outside of the country, they get sick, they go to a particular office in that country that they're in, and then they try and submit that. Well, guess what? It's not going to cover it because it's not, again, part of the worldwide emergency room coverage. So look at that, get familiar with that, because I have gotten a couple of calls in reference to that, to where they go out of the country, they go see a particular doctor, and I always tell them, no, if you're sick, go to an emergency room. There's more probability that you can get help with the coverage of the service that you got in the emergency room rather than a particular doctor's office. So just some additional information you might be able to use. Next slide, please. Excuse me. Allergies are getting to me, so I apologize for that. Some of these additional coverages that are available, some of these plans do offer some additional, again, coverage. These benefits are available to individuals, like meal delivery, transportation, home air cleaners. Not every plan member will have access to the same set of benefits, because as you may know, there are some individuals that have Medicare and Medicaid, and the Medicare Advantage plans do offer what's called, some individuals call them as special needs plans that are available because they have Medicare and Medicaid, so they can take advantage of some of these additional benefits that are available to them. Next slide, please. As far as the Medicare drug cost changes that are coming in, as you can see, now there's not going to be a coverage gap or donut hole. Now it's referred to as the deductible phase. You'll pay 100% cost until you spend $590, which will include the Part D deductible. And again, that deductible can change from plan to plan. During the initial phase, you'll pay no more than 25% coinsurance for covered drugs until you pay $2,000 out of pocket. After you hit the 2,000 threshold, you're going to be into the catastrophic phase, and again, after you hit the 2,000 threshold out of pocket for your medications, you'll pay nothing else out of pocket as far as for the rest of the year in 2025. Now, unfortunately, these out-of-pocket limits do not apply to Part B drugs that are provided usually by medical professionals in an outpatient hospital setting. So you need to be very careful with that. Next slide, please. Other things to consider before joining a plan: is your drug coverage as good as credible for the Medicare drug coverage? Do you have other current coverage through, like I said again, through your employer, through your spouse? And how does that coverage work with Medicare? Is joining into a plan, is that going to affect your current coverage that you have with your spouse or your employer group health plan? Next slide, please. Extra help, dual and partial dual eligible special enrollment periods. Again, this is because you have Medicare and you have Medicaid, or like it says there, you have Medicare and any form of Medicaid. There are some good benefits that are involved with that. these plans that are go both with Medicare and Medicaid, they're referred to as dual enrollment plans. Also, I've heard them as dual complete plans. So you can change these plans one time per calendar quarter in the first 3 quarters of the year, like with the Medicare Advantage plans. If you enroll on January the 1st, you have until March 31st of each year to decide if you want to go continue with it or let it go. Okay, so be aware of that. Watch for that, because some individuals do decide they don't want to stay with the Medicare Advantage plans. They can either change to another Medicare Advantage plan or go back to original Medicare within those first 3 months. Okay. Now, next slide, please. IRMA, very important. What's IRMA? It's an extra amount some people have to pay in addition to their plan premium. Does everyone pay IRMA? No, it's based on your income. And fewer than 7% of individuals have to pay it. And again, where does that money go? IRMA amount goes to the government, to or for the Medicare Trust Fund. Next slide, please. This is a slide that indicates how it would indicate how you would have to pay accordingly depending on your income. Again, these are individuals that have high incomes. Again, if you're up 103,000 a year up to, you can see where the breakdowns are. If you're $103,000 a year up to $129,000 a year, what you may pay each month for your monthly premium. Again, on top of the plan premium, these are some additional costs that do go with you. And this is, again, IRMA. This is because of the high cost. But again, like it was the slide was indicating earlier, usually about 7% of individuals usually fall into this and have to pay that. Next slide, please. Star ratings. A lot of these plans have star ratings. The star rating, pretty much what it indicates is how good the service is by a particular insurance company. So the higher the star rating, the better the service that the plans is. And these are surveys that are done by the companies, and sometimes these companies get a third entity to do the surveys for them, and then they get this information. Okay, so you just, as far as the star rating, if you find a plan that's a 5-star rating, you switch to a 5-star Medicare Advantage plan with or without drug coverage, or a drug plan is available to you, to them. Enroll once per year from December the 8th through November the 30th. And then keep in mind that new plans start on the first day of the month after you've enrolled. Star ratings assigned in October and are effective on January the 1st. And you may have a coverage gap and pay a penalty if you switch to a plan with no drug coverage. Again, like I was talking about, the Medicare Advantage plans with prescription drug coverage. Next slide, please. Again, ways that you can enroll into these Medicare Advantage plans with prescription drug coverage. The Medicare.gov website. The plan gives you all that website gives you almost all the information that you need. We utilize it to get a lot of the information that is available to individuals. So again, you can go to the chiphelp.org website, and it kind of leads you to us anyway, but information is available to there. So you can go to the website, or you can even call the 1-800-Medicare phone number to get them to get you to CHIP, which again, if you're in our area, it gets you to your particular designated area where you are at and the services that are available in the area. Next slide, please. Here we go. Here's the what I was talking about earlier, the Medicare Plan Finder. What it is, it's the Medicare.gov website has the Medicare Plan Finder in it. And again, it gives you information as far as the Medicare Advantage plan. the standalone prescription drug plans, and even the Medicare, or what are referred to the Medigap policies. But a lot of individuals do call and say, hey, I heard about this Medicare supplement plans. That a lot of times that's what they're talking about. So I always have to ask them to clarify. Are you talking about the Medigap policies? And go through all of that information. So again, next month we are doing an in-depth presentation on how to use the plan finder. So just be aware of that. We are going to be giving that information next month. Okay, next slide, please. The Medicare.gov website. This is basically what it looks like. Next slide, please. The options that are available. There are some additional information that is available to you as far as to get information on the plans that are available to you. Next slide. And again, when you're looking through these, the plan finder, the Medicare plan finder, through this Medicare.gov website, very, very valuable, high value information that is available to the individuals that you can help individuals with to get to. So I refer a lot of individuals to this website so they can get additional information that from what we are already giving them. Next slide, please. These slides will be available to you. And so you can take advantage by looking at the slides to see what information is available through the Medicare.gov website. Again, just can't say it enough. Very informative. A lot of great information that you can utilize to help individuals with. Next slide, please. Protecting yourself from fraud is basically what this is about. You need to be careful as far as information during open enrollment. This is one of the rampant things that is out there. You're at a high risk for fraudulent activity. So be careful who you talk to, what information you give out, and to get that. But that website is this information is available to you. Please be careful who you talk to, what information you give. Okay, as you can see there, before you enroll in a plan, make sure you understand what the plan covers, how it affects your Medicare benefits and other health benefits that's available to you. Next slide, please. Information to help open enrollment. Again, the Medicare.gov website, or you can call Medicare directly, or reach out to the Texas CHIP, which the phone number there is 800-252-9240, and you get to us. And then, of course, Medicare directly. Next slide, please. And that was the last slide. And I want to thank you so much for your attention, for information. Again, my name is Simon. I'm a benefit counselor too with the Area Agency on Aging of North Central Texas. Any questions, any concerns you have, please feel free to contact us. If you dial the 1-800-272-3921 number, that gives you to our office, and any one of us would be more than glad to give you any information that you need. If you want to talk directly to me, my extension is 45687, and leave me a message. If I don't answer, leave me a message and I'll get back with you. Okay. Thank you. Have a great day and be safe out there. Okay. Take care now. Bye-bye. Thank you.
Great stuff, Simon. I just have to jump in just real quick here because I have a news alert that just came up over my computer, and it just says, don't ever contact Marty Mascari about Medicare or Medicaid because I will not be the one to be able to help you. You'll get lost. And so I just had to make that quick news alert. Call Simon, don't call Marty. Sorry.
You are funny, Marty.
The best information that Marty will give you is call somebody else. Call Simon.
Call Simon. But you know what, Simon, I'll be calling you before very long. So I'm gonna go and go through it.
We are here for you, Marty.
Sorry.
That is great. Well, thank you very much, Simon, for that important information open enrollment is a very busy time, and we do suggest that everyone who is on Medicare and has a Part D plan to review their coverage, because you may be fine with what you have, but maybe some costs have changed. Maybe your prescription has changed. So it's important to take advantage of the time to review it so that you don't have additional out-of-pocket costs for next year. All right. Well, without further ado, we will now have Angel Hanzik present for Texas Senior Medicare Patrol.
All right. Thank you so much, Melinda. And thank you so much, Simon. That was awesome information. And so now we're going to switch gears a little bit because as we know with open enrollment, you start getting a lot more correspondence, right? You start getting a lot of emails and text messages and phone calls, even though it may not necessarily be allowed, right? But we want to make sure that all the correspondence that we're receiving, we're able to actually know if it's legitimate or not. So today what we're going to be doing is we're going to be talking about phishing and other phone scams, okay? Once again, my name is Angel Hanzik. I'm the program director over here with the Texas Senior Medicare Patrol. And I'm super excited to do this with y'all. And this will be a little interactive. So please keep your chat open because I'm going to ask y'all a few questions and I will be reading y'all's responses. Okay, let's get going. So first up, who is the Texas Senior Medicare Patrol? So we are a federally funded program, and we are housed here in Houston at the Better Business Bureau's Education Foundation, but we do cover the entire state of Texas, so corner to corner. And also there is a Senior Medicare Patrol in every single state in the United States, as well as all the US territories. Anywhere you can get Medicare, you can access a Senior Medicare Patrol. And so what we actually do is we recruit and train professionals and volunteers about Medicare fraud so that they can share that information with others. Okay, so that's our big thing, is spreading the word about Medicare fraud so we can reduce that as much as possible. And we are also a reporting agency. So you can actually call us and report any fraud that you're seeing, any Medicare fraud that you're seeing. And then we actually create a case with you and send that over to Medicare fraud control units. So that means Medicare, of course, right? But also local law enforcement all the way up to the FBI. Okay, because fraud is a crime and we want to get it covered as quickly as possible. All right. Our mission is to empower and assist Medicare beneficiaries, their families, and caregivers to prevent, detect, and report healthcare fraud, error, and abuse through outreach, counseling, and education. A big mouthful to say we talk about Medicare fraud all day, every day. Okay, so now go ahead and open up that chat box and start telling me, what do scammers want from you? Whenever you are being solicited by scammers, whenever they start calling you on the phone, what are they asking you for? What are they trying to get from you? And then I see Scott says money. Melissa says date of birth, social security, our money, our personal information, Medicare number, gift cards. Yes, 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 our identity information. All of this is 100% correct. So first up, I have, let's see, money, gift cards, credit cards, right? This is all different forms of money, right? They all just want cash, okay? Our bank information, okay? They want direct access to our money. But of course, we're not going to share that, right? We're starting to become savvy enough to know, hey, like I don't need to be sharing that kind of information. If somebody's asking me for gift cards, this is a red flag, right? Of course, they ask us for our social security number, okay? Our Medicare number. These are things you all touched on already, right? Not only can our social security number be defrauded, our identity can be stolen, our medical identity can be stolen as well. And then, of course, stuff like our date of birth, our personal information, right? They need access to those sort of things so that they can confirm our information whenever they're pretending to be us, talking to different agencies, or trying to open accounts in our names, or trying to answer our security questions, okay? So they're trying to ask all of these questions of us, okay? But how are they getting our information? Okay, what are they actually doing to get that information? How do they know your phone number? Anybody? Anybody in the chat? What about good old, let's see, dumpster diving? Did you know that they still dig through our trash? Right? They'll go and they look through trash and find sensitive documents that we have thrown out. Okay, that's why it's super, super important for us to shred documents that we no longer need and not just toss them out. Okay? Also, shoulder surfing, right? Super old school. I'm going to look over your shoulder while you're working on your laptop at Starbucks or while you're checking your bank account, at the grocery store. I'm looking over your shoulder and I'm taking a peek so that I can get your information. Okay? And as Cheryl said, public records. A lot of our information is completely open to the public. Our address, our email address, if we're married, where we live, right, our property, that's all online. I tell people all the time, we are Googleable, okay? A lot of our information is out there on the internet. Social media as well. We willingly put a lot of our information on the internet, right? We tell people online a little too much information. A really easy one that I tell people all the time is don't tell people when you're going on vacation, right? Like don't just put that on social media of, hey, my house is going to be empty for a week. No one's going to be there. Come rob me. That's basically what we're saying whenever we're putting information like that online. Okay, so we want to be super careful on what we're sharing on the internet because also nothing is truly private when we put it online. Right? You can have your profile set to private, but also a lot of people are able to access that information. And then of course, other scammers, right? Once a scammer gets your information, they're not really worried about protecting your identity, right? They're looking to make $1. So they are going to actually sell that information to other scammers in order to make a profit off of you. So they just keep selling your phone number, date of birth, other information that they have on you. And that's how other scammers get your information as well. And then of course, you accidentally share information all the time. Like we said on social media, right? We do that all the time. But what about whenever we get those phishing texts or those emails or those calls from those scammers? Oftentimes we may be sharing information without actually meaning to because we don't realize that they are a scammer. And so that's what this whole presentation today is about, is actually being able to know when it is a scam and when it may be legitimate. So let's talk about phishing scams, okay? So if you have an email address, right? If you have a cell phone, if you get text messages or Facebook messages, you have definitely received a phishing scam, okay? And so what this is it is a mass message that is sent out to all the people on this scammer's mailing list, okay? Asking you to do something urgent, right? Such as verify your banking information. They pretend to be your bank and say, there's an issue with your account, verify your information now, click here. A really popular one right now is text messages, right? And getting that message that says this is the USPS and your package cannot be delivered. Click here to verify your information. That is super, super common. Or claiming that you owe money to some organization. Okay, so there will be some sort of urgency in the message, right? Saying that something has happened and you have to click here, right? To click here, go to this website, download this, okay? But we want to be super, super careful whenever we have an attachment in a message from somebody that we don't know, okay? Or even somebody claiming that we do know. Because what that could be is that could be viruses that we download onto our device. Okay, so anytime there's a link in there or some website or something to download, we don't want to interact with that unless we're 100% certain that we know this sender. Okay, because then they'll start tracking our typing, they track where we go, and that's how they get your information. Okay, good thing to do is verifying the sender's email address, right? I can put my name as anything. So on my email, it says from Angel Hanzik, ahanzik@bbb.org, right? But I can put my name as Amazon.com and still having it come from ahanzik@bbb.org. Okay, so we actually want to go and hover over that and make sure that that email address actually is matching what they're claiming to be. Okay, if they're saying that they're emailing you, from Amazon, but if they say that they're emailing you from Amazon, but their email address is 12345@gmail.com, well, now we know this is not actually Amazon, right? So that's one of the first things that we want to look for. Okay, we also want to look for any weird logos, right, in the email that may seem crooked or blurry, like they were cropped in or copy pasted in, right? And also a big one are grammar errors, okay? Formatting and grammar errors, okay? These big companies that would be sending you correspondence, they aren't making those silly little grammar mistakes, right? So we do need to be looking for those. And anytime that we have something with high urgency, we want to be wary, right? A lot of agencies don't require a lot of high urgency because they're typically going to be corresponding with you through mail. If it's something that's super important, like something from Medicare or the IRS or Social Security Administration, right? They're not sending you text messages or emails. And so we don't want to interact with any of those links or downloadables. We just want to actually delete it. Okay, and we also want to, if we're not sure of the legitimacy, right? Maybe we do have a package coming from Amazon. It should have been here today and it's not. We don't want to click the link in that message. Instead, we want to go to the Amazon app, right? On our phone, on our laptop, wherever, and check through our profile there. Okay, that's the safest way, is actually going directly to the source. Okay, so next I'm going to show y'all some examples of different phishing emails. And I want you to put in the chat, what are the red flags that you see? What is in there that seems off that would make you suspicious and not interact with this email? Okay, so here we have an email from Walmart, right? Something about our order, our delivery failed, and so we need to update our address. So first step, yes, double L Walmart. Double L Walmart, that is 100% correct. We also have somebody saying, Michelle is saying, dear client, right? That's a bit impersonal. It's a little sketchy, right? Shouldn't they have my name if I did my order through my app? Let's see, we have another spelling issue with address. Okay, all right. Carrie says, wishing you happy day, question mark, question mark. Yeah, that's a pretty good one. Time frame as well, right? We only have 48 hours to do it or else we won't get all of our money back. Okay, so let's look at all the ones here. Okay, double L Walmart, right? Dear client, update your address or reply us, not reply to us, just reply us. Another misspelling and wishing you happy day, right? Here is an example of some phishing text messages that people have received. So go ahead and give a look-see and let me know what you think. We have one that's saying that they are from a bank and another saying it is about our Netflix premium membership. See, okay, yeah, grammar issues. Grammar issues, right? Anything more specific? See, we have violation is misspelled, information is misspelled. The URL isn't to Chase Bank. Yes, exactly. Carrie said that as well. It says tinyurl.com, but it has nothing to do with Chase Bank at all, right? The URL for Netflix is misspelled. I don't even know if I caught that one. NetFT fix instead of Netflix. Too many capital letters. Yes. Okay, now let's look at some of these. right? Again, we have our dear client. They don't even know our name, right? See, tiny URL. There's no space in between the period and information. We were both capitalized. We will charge, all capitalized. If we are not able to complete, right? So y'all caught more in here than I had originally circled. So that is great. Y'all are already up on top of it. So now let's go ahead and look at our last one here. And we have an email from Microsoft Office 365, saying that they're detecting spam messages, and that our account is going to be blocked. Okay, what do we see in here? Sender email address, right? We have mail to CYH11241. Forced, not forced. Wrong date. Old copyright. Nice, nice. It is threatening, right? It's urgent. We are threatening you, saying you're not going to have access to this anymore. Okay, so boom, y'all caught it. Yes, the mailing address is wrong. Also, detected spam messages from email appeared here. There's no email there, right? They didn't actually even put in our address. They didn't even code this email right. Okay. Also, we have a link here that we can click. We can click here and verify now, right? Which is going to take us to a great fake website, or download a virus onto our device. So that sounds like a great link that I will not be clicking. Y'all caught on to 1,000 things in this one, so y'all are great. Microsoft Office 365 team also, another link there that we can click. Also, capitalization issues. Microsoft Office is capitalized with a space between Office and 365. So now let's move into some other phone scams that we're seeing, right? It's not just phishing scams that we have to be wary about. We also have to be on the lookout for spoofing calls. Okay, and so this is actually when a scammer utilizes a software to change the number that comes up on your phone when they call you. So I could be calling you from my personal number, and I can make it look as if I'm calling from 1-800-MEDICARE or the Social Security office or the IRS, right? I can make it look like anything that I want. But typically what scammers will actually do is they will call from just a bunch of different numbers. It's the same scammer, but you may be blocking the number that's coming up on your phone, right? You see this one number calling over and over again, you block it, you know it's a scammer. So they just change one digit or 2 or 5 or the whole number, and they just keep calling you. That's how they're able to get through. We really encourage you to put a screening on your phone, right? You can do that if you have iPhone. I'm sure there's apps as well for Android where you can actually make it where unknown callers go directly to your voicemail. So your phone isn't even ringing with all those scam calls that we all get. Okay. And typically scammers will not leave a voicemail, but if they do, we do want to check to see if that callback number is the same as what they called us on, right? Because in your phone, it'll say that I'm calling from 1-800-MEDICARE, but I'll tell you to call back at my number, because if you call 1-800-MEDICARE, you'll get Medicare and not me. Okay, so please watch out for this one. In this same vein, we need to watch out for an AI scam. Artificial intelligence is really big, right? And it's growing. And they usually use this in conjunction with the grandparent scam. And so what this is you'll get a call saying that it's your loved one, saying, help, help, grandma, it's me, it is your grandchild. I'm in an emergency and I need $500. Please don't call anyone, don't tell anyone, just send it over to me. And it may sound just like your actual grandchild or your actual loved one because of the use of artificial intelligence. They can make it sound like anybody in the world through voice cloning software. Okay, so our big recommendation for you is to consider using a family code word, right? Just sitting down and saying, hey, you know, if something really happens, it's an emergency, you call me in the middle of the night from a random number, say pineapple, and I'll know it's you, and then I can get you the help you need, and I don't hang up on you in the middle of your emergency. Okay, so please watch out for this. I'm gonna skip through a couple because I know we're a little short. But also letting y'all know it is an election year, and this AI scam is also being used in conjunction with election scams. And so they are actually using that voice cloning software to impersonate politicians, different presidential candidates. So that they'll call and it'll sound like your insert favorite candidate here is calling you and saying, hey, I really need your support. Will you please donate $20 to us? Okay, right. Let me just tell you right now, no presidential candidates are calling people. There's millions of Americans out there, and that's just going to take way too much time. Okay, so they are not calling individuals. So just know that this is a scam. If you hear insert politician here, they are not actually calling you. Going to skip ahead to Medicare scams because I know we're almost out of time. Please watch out right now, of course, during open enrollment, but also all throughout the year for any offers of free products or services in exchange for your Medicare number, right? This one is tried and true. They'll do it 1,000 times in 1,000 different ways, saying you get a free wheelchair, free back brace, you know, free glucose monitors, free anything in exchange for your number. Just letting you know, your doctor is not calling you and screening you and doing that, right? If you needed these products or services, your provider would offer them to you. And please double check and make sure that they are covered in your insurance, right? Because nothing is actually free. Maybe Medicare is paying for it, but that doesn't mean that it is free. Also, like we said earlier with spoofing, any calls from Medicare are actually going to be spoofed. Okay, so we know 100% of the time that is a scam. Medicare is not calling you. Okay, and specifically right now as we come into open enrollment, we need to watch out for agents or brokers rushing us into decisions. Okay, there's a lot of great agents out there talking about wonderful plans. But there's also ones out there who are offering limited time offers, and you have to sign today in the next 24 hours in order to get this special deal with Medicare. That's not happening, right? You have the entire enrollment period to make a decision. And so if someone is rushing you into a decision, we don't even want to be interacting with them because now we're stepping into a lot of violations there, okay? And a lot of scams. So, and then finally, we have new Medicare cards available, and they're plastic with a chip in it. So you can tap at the doctor and it'll fill out all your forms, and it sounds amazing, right? Except you have to pay $300 for it. Give me your Medicare number, and also it's not real. This is a scam that comes up, pretty often. And right now it's going to have a resurgence as they offer, this new Medicare card that you get whenever you sign up for this new plan during open enrollment. But of course, we all know there's no new Medicare card, and you definitely don't have to pay $300 to receive your Medicare card. So we know outright that that is a scam. Okay, really quick. If you are a victim of Medicare fraud, right, the easiest way to know is by checking your Medicare summary notices. And if you're seeing something suspicious, we encourage folks to call your provider first in case there is a mistake, and then call the Texas Senior Medicare Patrol, which is us, so that we can go ahead and get that moving and grooving, because there is so much money lost out there, and there's no way for us to know actually what scams are happening unless they're being reported. That's the only way that us, Medicare, the FBI, any agency is actually able to assist in stopping the scams is if they're reported. Otherwise, we have no idea what's out there. If you're a victim of any other type of fraud, even if we did not talk about it today, I also encourage you to report. to the betterbusinessbureau.org, but even more than that, to the Federal Trade Commission for the very same reason that I encourage you to report Medicare fraud. There's no way for us to know what's out there unless the community is actually reporting on it. And now that I'm 2 minutes over, I'm so sorry. I will open it for questions or leave Melinda or Marty to close me out. But thank you so much for your time, participation, and attendance today. It has been wonderful.
Thank you, Angel. And before we get to questions, if you could go to the next slide and Marty can go ahead and do the continuing education.
Perfect. Thank you so much. For those of you that have joined us today for CEUs, we're providing complimentary CEUs for licensed social workers, licensed professional counselors, and we're set up for the state of Texas. If you have a different license in Texas or a license outside of Texas, you're more than welcome to go through the process, get the certificate, submit it to the jurisdiction, but please note that there's no guarantee that they'll take that. I think I said earlier, I have had a couple of jurisdictions from outside of the state even contact me, asking me for more information, and I believe they took it. They were looking for the copy of the slide or something just to have some documentation that it was the content was what it needed to be in order to qualify for the CEUs. We're also offering certificates of attendance. Those are free of charge as well. In order to qualify, it's worth 1.5 hours of CEU credits, but you must have attended the entire live webinar. If you had a little bit of problem logging on at the beginning, it shouldn't affect you, but you must attend the entire live webinar, and then you must also complete the Google survey that should pop up as you're closing out of Zoom today. If not, no worry, there'll be an email going out tomorrow morning that will have the link to the survey in it. Please complete that before next week, this time next week, and then give us about 4 weeks after that to get those certificates emailed out to you. They will be sent to you by email. If you don't have it by the 26th of October, please feel free to reach out to me, and then we'll look into it and see what's going on. Do you want to go one more slide and we'll talk about next month's? Okay, and I'll let you talk about that, Melinda, if you'd like, and then.
Oh, all right. That is this month's. For
that is
that's
yeah, well, yeah, you know. Okay. You know what? I didn't have you download. I uploaded it and uploaded right afterwards. I'm sorry. I'll pull it up.
No problem. So what we want to all is that next month we will be doing it again on the 3rd Thursday. So October 17th, we will be presenting on how to use the plan finder. That is a very, very important topic, as well as the ones today, because it will be open enrollment time, and that is the best place to compare your prescription drug coverage. So October 17th, 10 a.m., we're going to be talking about how to use the plan finder, and we're going to talk about some more open enrollment scams, not only phishing scams, but other scams during open enrollment. So definitely join us for that as well. Tell others about it so they can be informed. The more people who are informed about this information, the more we can help our community. All right. Felicia, did you have?
Yes.
Okay.
Thank you, Melinda. I'm sorry. I apologize to everyone. My fingers got happy in the Q&A, and I just wanted to clarify that it was a question. Is prescription drug coverage the only one that has a penalty when signing up late? And the Part B premium is 10% per year, and Part D is 1% per month for each month someone is eligible and did not have prescription drug coverage. So again, it's important to avoid all of the penalties and just sign up when you're eligible for Medicare.
I would like to say that I think that it comes across as a scam from our own government scamming our people when you're got elderly people that don't sign up on time and you're penalize them. Just my opinion.
Well, yeah, and that's fine. But some are low income, and then if they qualify, they don't have to pay that. So it's
If you
that
qualify for
income.
extra help, right? Or
Mhm.
Medicare
Okay.
savings programs.
So
Yeah,
yeah,
some of them
I
are
know.
just $1 over or $5 over, unfortunately, but sometimes there are other ways to get assistance. And so,
Yeah.
We just encourage people to reach out to seek that assistance. Sometimes we can help them indirectly.
Yes.
Well, all the questions, thank you, Felicia, for
Thank you.
clarification. All the questions in the chat were answered, except there was one that came in. Will Medicare ever come out with a durable plastic card like insurance companies do instead of the paper version? That's a good question. We have not heard anything about that. Angel, have you heard anything?
No, from my understanding, that's not in the works, right? That's not what anything that could come up in the next few years. But if it did, I mean, we would all know. It'd be national news, right? It'd be everywhere.
Exactly.
So
Exactly. And
Yeah,
it's possible because it could change so much. People lose their card and then they get a new number. It's not like it used to be when it was the Social Security number. So yeah, I don't see it happening anytime soon, but you just never know. There are some other things I thought wouldn't happen and they're happening. So
yeah. And that's just another way for the scammers to get you. We have a new card for you.
right.
Yeah.
It's a rewards card.
Right.
oh
You
yeah.
could use it.
Mhm. And that may be why they keep the paper card, just because of all of that.
Y'all, just so you know, if you downloaded the slides during the presentation, that last slide should be right with next month's presentation on it, and I will also have it fixed when I send out the follow-up email. But I think if Melinda, if you guys re-download the presentation, it should come down with the right one. I figured it out 5 minutes after I sent it out and fixed it. But
that's fine. And Angel put it in the chat. So thank you, Angel, for that.
okay. Y'all, thank you so much.
Thank you again, Marty. And thank you everyone for joining us today. And we hope to see you next month. Bring a friend.
Bring a
There
friend.
you go. Sounds good.
Thank you all.
Bye, everyone. Be safe. Bye.
Bye-bye.
Thank you, Simon.
Thank you,
Thank
Simon.
you, Simon. Leslie.
Leslie. Felicia.
Out of sight, out of mind.
Angel.